Imagine a world where no matter what language you speak, you have access to, cutting edge medical analysis.
Yeah.
And where AI can like seamlessly interpret your X-rays
Yeah.
or CT scans
Yeah.
in real time.
Yeah.
That's the kind of future BiMediX2 is building.
Yeah, it's definitely pushing the boundaries of what's possible in healthcare.
It is.
Yeah.
It is. Today's deep dive is all about this breakthrough technology.
Okay.
You shared some research excerpts on BiMediX2 with me.
Right.
And we're going to unpack what makes it so special
Okay.
and what it means for the future of AI in medicine.
Sounds good.
Our source material is BiMediX2 Biomedical Expert, LMM, for diverse medical modalities.pdf.
What I find fascinating is that BiMediX2 isn't just another medical AI.
Yeah.
It's tackling a really critical issue in the field, and that's the language bias
Right.
in existing system.
That's right.
Yeah.
Most medical AIs are heavily focused on English, which leaves non-English speakers, especially large populations, like Arabic speakers, with limited access to these advancements.
Yeah.
It creates a significant gap in healthcare.
Huge gap.
Huge gap, yeah.
And there's another challenge that BiMediX2 tackles head-on.
Okay.
A lot of current AI models struggle to integrate visual analysis with a deep understanding of textual medical knowledge.
Okay.
They might be great at reading an X-ray, but not so good at connecting it to the bigger picture of a patient's medical history,
Right.
or understanding the nuances of a written medical report.
So it's like they're either good at seeing or reading,
Yeah.
but not both at the same time.
Exactly.
Uh-oh.
And that's where BiMediX2 comes in.
Okay.
It's designed to be both bilingual,
Good.
working seamlessly in both Arabic and English,
Right.
and multimodal, meaning it can process both text and images
Yeah.
with a level of sophistication we haven't seen before.
It's like having a doctor who's fluent in 2 languages.
Yeah.
And can understand both your medical history and your latest scan results.
A perfect analogy.
Yeah.
Yeah, the research calls BiMediX2 a biomedical expert, or BiMediX for short.
Okay.
And one of the things that makes it so unique is how it's built.
Okay.
It uses a powerful language model called Llama 3.1, which gives it incredible processing power.
Okay, I'm intrigued.
Yeah.
Can you break down how this architecture actually works?
Think of it as a team of specialized components working together.
Okay.
First, you have the vision encoder,
Okay.
which acts like the eyes of the AI. It analyzes the medical images, whether it's an X-ray, a CT scan, an MRI,
Right.
or even microscopic images like histology slides,
Yep.
extracting key features and patterns.
So it's not just looking at the pixels, it's
Yeah.
actually recognizing medically relevant information
Exactly.
in the images.
And then you have the projector.
Okay.
This component plays the crucial role of connecting what the AI sees in the images
Okay.
to the vast world of medical knowledge stored within the language model. Right.
It aligns the visual data with text,
Okay.
ensuring the AI understands the context of what it's seeing.
So if the vision encoder detects something unusual in a scan,
Yeah.
the projector helps the AI understand what that might mean medically
Exactly.
by connecting it to relevant medical information.
It's like the projector is translating the visual language of the images
Okay.
into something the language model can comprehend.
Gotcha.
And at the heart of it all is Llama 3.1.
Yeah.
It's trained on a massive amount of text data,
Right.
making it incredibly fluent in understanding and generating human-like text.
And this fluency is in both Arabic and English, right?
That's correct.
Okay.
BiMediX2's language model has been trained on a massive amount of medical text
Yeah.
in both languages,
Okay.
giving it a deep understanding of medical terminology,
Yeah.
concepts, and relationships in both Arabic and English.
That's quite remarkable.
Yeah.
So we have this incredible fusion of visual processing and
Yeah.
language understanding.
It all works together, all working together to analyze complex medical information.
But the secret sauce that truly elevates BiMediX2 is the fuel it runs on, the BiMed-V dataset.
Okay, I remember reading about that.
Yeah.
It's huge, isn't it?
It's massive. We're talking
man.
about 1.6 million samples
Wow.
of diverse medical interactions, including text, images, and reports.
Yeah.
And the impressive part is that it's all in both English and Arabic.
How did they manage to create such a massive and diverse data set in 2 languages.
Yeah.
That must have been a challenge.
They used a very clever approach.
Okay.
They utilized the power of another AI, GPT-4o,
Okay.
to translate a huge chunk of existing English medical data into Arabic.
Wow.
And to make sure the quality of the translation was top-notch,
Yeah.
they had medical experts verify a random subset of the translated data.
That's a very innovative way to leverage existing resources and
Yeah.
make sure the data is both accurate and culturally relevant.
Yeah, it really is.
Yeah, this bilingual data set is what truly allows BiMediX2 to be proficient in both languages.
Exactly.
But how do we know if it actually works?
That's a great question.
Yeah.
Traditionally, medical AI was evaluated using multiple choice questions.
Okay.
But that's not how doctors diagnose patients in the real world.
Right. It's much more nuanced than just picking an answer from a list.
Exactly.
Yeah.
So the researchers took a different approach with BiMediX2.
Okay.
They tested it using more advanced methods
Right.
that reflect real-world medical practice, such as visual question answering, report generation,
Okay.
and summarization.
So they're testing its ability to analyze images,
Yeah.
have conversations about those images,
Right.
and even create medical reports.
Exactly.
It sounds like they're really pushing the boundaries of how we evaluate these AIs.
Absolutely.
Yeah.
They even developed a brand new benchmark called BiMed-MBench,
Okay.
specifically designed to evaluate bilingual and multimodal medical AIs.
So a benchmark made just for BiMediX2.
Essentially, yeah.
Okay.
But I think what you're really interested in are some concrete examples of BiMediX2 in action.
You read my mind.
Yeah.
I'm eager to see how this all translates into real-world scenarios.
Yeah.
Give me a situation where BiMediX2 really shines.
Let's say a patient comes in with severe back pain after a fall.
Okay.
You, as the doctor, order a CT scan of their lumbar spine.
Okay, I'm following.
Okay.
I'm the doctor.
You're the
I
doctor.
have the CT scan,
Yeah.
and I'm interacting with BiMediX2.
Yeah.
What happens next?
BiMediX2, in clear and easy-to-understand language, might tell you.
Okay.
This is a sagittal view of the lumbar spine.
Mm-hmm.
It's a vertical slice showing the bones and soft tissues in your lower back.
That's helpful.
Yeah.
But as a doctor,
Yeah.
I'm looking for more than just a description.
Right.
How would I get BiMediX2 to help me with the diagnosis?
You can be very specific with your questions.
Say
You can
how.
ask, what's the abnormality here?
Okay.
And BiMediX2, after analyzing the scan, could pinpoint there's a fracture in the L4 vertebra.
Wow.
It might even explain what a fracture is and the possible causes,
Yeah.
like trauma from a fall,
Okay.
in a way that's easy for both you and the patient to understand.
That's incredible.
Yeah.
So it's not just reading the image.
It's going a step further.
It's understanding the medical context
Yeah.
and providing clinically relevant insights.
It's like having a super smart consultant right there with you.
This is fascinating.
Yeah.
Let's hear about a scenario where BiMediX2 is used in Arabic.
Let's imagine you're looking at an ultrasound of a patient's ovary.
Okay.
You can ask BiMediX2 in Arabic,
Okay.
what kind of scan is this?
And it will understand and respond in Arabic.
Yes.
Right.
BiMediX2 could tell you in Arabic, this is a color Doppler ultrasound scan.
Hmm.
It uses sound waves to create images and show blood flow.
Okay.
You can then ask, is there anything abnormal in this scan?
Okay.
And BiMediX2 might identify potential ovarian cyst.
Explaining what that could mean
Yeah.
and why further evaluation is necessary.
Right.
All in Arabic.
That's incredible.
Yeah.
What you're describing has the potential to transform global healthcare
Yeah.
by bridging language barriers,
Yeah,
making these advanced tools accessible to a much wider population.
Yeah, it's really breaking down those barriers.
Is.
Yeah.
But I'm curious, how does BiMediX2 compare to other leading medical AIs like GPT-4?
That's a great question.
Yeah.
BiMediX2 was put through a series of benchmark tests,
Okay.
and the results are quite impressive.
Yeah.
It consistently outperforms other leading medical AIs, including GPT-4, in various tasks.
Beating GPT-4 is quite a feat.
Yeah.
It's considered the gold standard in AI.
Yeah, it's up there.
Right.
Yeah.
I'm curious, what are some of the specific areas where BiMediX2 really excels?
One area where it really stands out is UP Hill factual accuracy.
Okay.
This test measures how well an AI can identify and address false medical
Okay,
claims.
essentially combating medical misinformation.
Interesting.
BiMediX2's performance here is significantly higher than GPT-4.
Wow.
Demonstrating its ability to not only understand complex medical information,
Yeah.
but also critically evaluate its validity.
Yeah.
And what's particularly remarkable is that BiMediX2 achieves this level of accuracy in both English and Arabic.
That's a crucial advantage.
It is.
Especially given how rapidly medical misinformation can spread.
Especially these days, yeah.
Yeah.
It highlights BiMediX2's potential to be a powerful tool in the fight against misinformation.
Right.
And ensure patients have access to accurate medical information.
So it seems like BiMediX2 is setting a new standard for what's possible with medical AI.
It's raising the bar.
It's clearly a major step forward in making healthcare more inclusive and accessible.
Absolutely.
Yeah.
It's an exciting development, and it paves the way for a future where AI plays an even more significant role in improving patient care worldwide.
Yeah. But I'm sure you're eager to hear more about how this impressive performance was achieved.
You're absolutely right. Let's dive a bit deeper into the technical details in part 2 of our deep dive.
Welcome back to our deep dive into BiMediX2.
In part 1, we talked about how BiMediX2 is tackling some major challenges in healthcare, and how it's designed to be both bilingual and multimodal.
Right. And now we're going to take a closer look at how this groundbreaking AI is actually built.
I'm ready to get a little more technical.
Okay, so let's break down the key components, starting with the vision encoder.
Okay.
Think of it as a specialized neural network trained to understand the visual language of medical images.
So it's not just seeing the images, it's actually extracting meaningful information from them.
Exactly.
Okay.
The vision encoder takes those images, whether they're X-rays, CT scans, MRIs, or even microscopic images, and it identifies the important features and patterns that are relevant from a medical perspective. So it's like giving the AI a set of medical eyes.
That's a great way to put it.
Yeah.
But recognizing those features is only the first step. The real magic happens when those visual insights are connected to the broader world of medical knowledge.
And that's where the projector comes in, right?
Exactly. The projector acts as a bridge between the visual world of the images and the textual world of medical information.
I'm trying to picture how that works.
Imagine the projector is like a translator.
Okay.
It takes the raw visual data extracted by the vision encoder and converts it into a format that the language model can understand.
So if the vision encoder sees a shadow on a lung X-ray, the projector helps the AI connect that visual finding to the concept of a possible tumor.
Precisely.
Okay.
It aligns the visual and textual information, allowing the AI to make those crucial connections between what it sees and what it knows.
And then Llama 3.1 steps in as the brains of the operation, processing all this information with its vast medical knowledge.
Right. Llama 3.1 is a large language model that's been trained on a massive amount of data, making it incredibly fluent in understanding and generating human-like text. But what makes it truly special for BiMediX2 is that it's been fine-tuned specifically on a massive data set of medical texts.
So it's like a language model that went to medical school.
Exactly. And since BiMediX2 is bilingual, Llama 3.1 has been trained on medical texts in both English and Arabic, giving it the ability to understand and communicate effectively in both languages.
It's this combination of specialized components. The vision encoder, the projector, and the powerful language model.
Working together.
Working in perfect harmony that allows BiMediX2 to achieve such remarkable results.
It's a symphony of AI, each instrument playing its part to create something truly innovative.
But the architecture is only one part of the story. We need to talk about the training process. How do they actually teach BiMediX2 to do all these amazing things?
You're right. The training process is where the AI truly comes to life. And it all starts with that massive BiMedV data set we discussed earlier.
The one with 1.6 million samples of medical interactions in both English and Arabic.
That's the one. This data set is the fuel that powers BiMediX2's learning.
But how does that raw data get transformed into AI intelligence? What does the training process actually look like?
It's a clever two-stage process.
Okay.
The first stage focuses on aligning medical concepts.
Okay.
Essentially teaching the AI to connect visual features from images with their corresponding textual representations in the language model.
So, for example, if the AI sees a fracture on an X-ray, it learns to connect that visual information to the word fracture in medical texts.
Exactly. And it does this for a wide range of medical concepts across different types of images and in both English and Arabic.
Yeah.
In this first stage,
Okay.
the focus is primarily on training the projector. Remember, the projector's job is to bridge the gap between the visual and textual information. So they feed the projector a vast number of image caption pairs where the image depicts a specific medical finding and the caption describes it in words.
So it's like showing the AI flashcards with pictures and words.
That's a great analogy
Yeah.
to help it learn the vocabulary of medicine. And through this process of repetition and reinforcement, the projector learns to accurately map visual features to their textual counterparts within the language model.
Okay, that's the first stage.
Right.
What happens in the second stage of training?
The second stage is where it gets really interesting.
Okay.
This stage is all about fine-tuning the language model itself using something called LoRa adapters.
I've heard that term before, but never really understood what it means.
Yeah.
Okay.
Can you break it down for me?
LoRa adapters are a way to make large language models like Llama 3.1 more efficient and adaptable. Instead of retraining the entire massive language model, which would require a huge amount of time and computing power. LoRa adapters allow you to make smaller, more targeted adjustments.
It's like adding specialized modules to the language model.
That's a great way to think about it without having to rebuild the whole thing from scratch.
Right.
And in the second stage of training, these LoRa adapters are used to fine-tune the language model, specifically for handling complex medical instructions.
So this is where BiMediX2 learns to do things like answer questions about medical images, generate reports, and summarize complex medical information.
Exactly.
Okay.
They use the BiMed-V dataset again.
Right.
But this time, they present BiMediX2 with more challenging scenarios.
Okay.
It might be shown an image and asked a question about it.
Or it might be given a set of images
Right.
and asked to create a report summarizing the findings.
So it's like putting the AI through medical school exams.
Precisely. Giving it challenging cases to solve.
And through this process of fine-tuning with LoRa adapters, BiMediX2 becomes incredibly skilled at understanding complex medical instructions. And providing accurate and insightful responses.
It's like taking the AI from having basic medical knowledge to developing specialized expertise in different areas of medicine.
That's the power of this two-stage training process.
Yeah, it is.
By combining concept alignment with this advanced fine-tuning technique, they've created an AI that can not only understand medical information, but also apply that knowledge in practical and meaningful ways.
Exactly.
It's incredible how they've managed to combine all these different elements. The vision encoder, the projector, the language model, the training data, and these LoRa adapters to create something so sophisticated.
It's truly a testament to the ingenuity of the researchers
Yeah.
and the incredible advancements that are being made in AI.
But of course, building a powerful AI is only half the battle.
Absolutely.
We need to make sure it's actually performing as expected.
You need to have a way to measure how well it's doing.
That makes sense, yeah. How do they evaluate BiMediX2?
Evaluation is a crucial part of the process.
Right.
Especially when we're talking about AI in medicine, where accuracy and reliability are absolutely essential.
Right.
And with BiMediX2, the researchers went above and beyond to ensure that it's being assessed rigorously.
I'm really curious to hear about how they test an AI doctor. What does that process look like?
They used a multifaceted approach, combining new and existing benchmarks to get a complete picture of BiMediX2's capabilities.
Right.
One of the key tools they used is a custom benchmark called BiMediX2.
Can you tell me more about BiMediX2?
Yeah.
What makes it so special?
BiMediX2 is unique because it's the first benchmark specifically designed to evaluate bilingual, multimodal medical AIs like BiMediX2. It takes into account both the language capabilities, English and Arabic, and the ability to work with both text and image data.
That makes sense. It needs to be tailored to the specific skills that BiMediX2 is designed to have.
Right, and BiMediX2 really puts the AI through its paces. It presents a variety of challenging tasks to assess BiMediX2's ability to understand medical images, extract relevant information,
Right.
and communicate that information effectively in both English and Arabic.
So what kinds of tasks are we talking about?
Yeah.
Give me an example.
One example is image description.
Okay.
BiMediX2 might be shown a medical image and asked to describe what it sees, focusing on the clinically relevant details.
Okay.
Another example is report generation, where BiMediX2 might be given a series of images from a patient's case and asked to create a concise and accurate summary report of the key findings.
It sounds like a real-world simulation of how a doctor might use this technology.
That's the goal.
Yeah.
The tasks in BiMediX are designed to be as close as possible to real-world clinical scenarios.
Right.
And it's not just about getting the right answer.
Yep.
BiMediX also evaluates the quality of the responses.
Okay.
Looking at things like helpfulness, relevance, accuracy, and the level of detail provided.
It's a comprehensive assessment that goes beyond simple right or wrong judgments.
Exactly. And to make sure the evaluation is as rigorous as possible, a team of medical experts reviews BiMediX2's responses and provides their expert judgment.
So they're not just relying on algorithms and metrics. They're bringing in human expertise to make sure the AI is truly performing at a high level.
That human element is really important. Especially when we're talking about AI in healthcare.
Right.
But BiMediX is just one piece of the evaluation puzzle.
Okay.
They also tested BiMediX2 using existing benchmarks to assess specific capabilities, such as visual question answering.
I remember we talked about that earlier.
Yes.
BiMediX2 was tested using data sets like RADVQA, SLAKE, and PathVQA.
Right.
Yeah.
These benchmarks are designed to test the AI's ability to understand complex visual information in medical images, connect that information to relevant medical knowledge, and provide accurate and insightful answers to questions about the images.
And BiMediX2 did really well on those tests.
It did.
Yeah.
The results really showcase BiMediX2's exceptional ability to see and understand medical images.
What about the tasks related to report generation and summarization?
Yes.
How are those evaluated?
For report generation, they used a dataset called MICCXR. This dataset contains chest x-rays and their corresponding medical reports. Okay. BiMediX2 was tasked with generating a report based on the x-ray, and its output was compared to the report written by a radiologist.
So it was like a head-to-head competition between the AI and a human doctor.
And for report summarization, they used a data set called MIMI3, which contains detailed medical reports from various specialties.
Okay.
BiMediX2 was asked to create a concise and accurate summary of a given report, capturing the most important findings and clinical information.
It sounds like they're really pushing BiMediX2 to demonstrate its understanding and communication skills.
They are, in a medical context.
And the results are very promising.
They are.
BiMediX2 consistently outperformed other leading models in these evaluations, demonstrating its ability to generate high-quality, informative medical reports and summaries.
But how do they actually compare the AI's output to the human doctor's report?
Or summary.
Right.
It can't be as simple as just checking for a right or wrong answer.
You're right. It's much more nuanced than that.
Yeah.
They use a combination of quantitative metrics, which are essentially numerical scores, and qualitative assessments, which involve human judgment to evaluate the AI's performance.
Can you give me some examples of those quantitative metrics?
They use metrics like BLU, RGG, and RADCLQ to measure things like how well the AI's language matches the language used by human doctors, how well it captures the important medical information, and how coherent and readable its output is.
So they're looking at both the accuracy of the information and the clarity and quality of the writing.
Exactly. And on top of these objective metrics, they have medical experts review BiMediX2's output to provide a more subjective assessment of its overall quality, accuracy, and readability.
So it's a really thorough evaluation process. It's combining the best of both worlds. The precision of algorithms and the nuanced judgment of human experts.
It's a great way to put it.
Yeah.
And that's what gives us confidence in BiMediX2's capabilities.
Okay, I'm getting a much clearer picture of how they built and tested this AI.
Yeah.
And it's all very impressive. But as we wrap up part 2, I want to bring us back to something we discussed earlier.
Okay.
The potential limitations of AI in healthcare.
You're right.
Yeah.
It's crucial to acknowledge that while BiMediX2 is a powerful tool, it's not a magic bullet.
Right.
It's important to remember that it's a product of the data it's trained on.
Yeah.
And if that data contains biases, those biases can potentially be reflected in the AI's output.
That's a sobering thought.
Yeah, it's something to keep in mind.
So if the training data primarily included medical images from patients of a certain demographic, the AI might be less accurate when analyzing images from patients of a different demographic.
That's one potential concern, and it's something that AI developers are actively working to address.
Yeah.
There are a lot of efforts to create more diverse and inclusive data sets to train these AIs to minimize bias and ensure that they're fair and equitable for all patients.
It's a reminder that AI is a tool created by humans.
Yeah.
And it's up to us to make sure it's used responsibly and ethically.
I completely agree.
Yeah.
As AI becomes more integrated into healthcare, we need to have open and honest conversations about these potential limitations and work collaboratively to mitigate those risks.
Yeah.
But for now, let's shift gears and dive into some specific examples of BiMediX2 in action in part 3.
Okay.
We'll see how this AI doctor performs in real-world scenarios.
Welcome back to the deep dive. We spent the last 2 parts exploring BiMediX2, this groundbreaking bilingual and multimodal AI that's making waves in the healthcare field. Now in part 3, let's actually see this AI doctor in action.
We've got some really fascinating examples straight from the research that show just how versatile and powerful this technology is.
I always love seeing theory put into practice. What's our first case study?
Let's picture a busy emergency room. A patient comes in complaining of severe back pain after a fall.
Okay, a pretty common scenario in the ER.
Exactly. The doctor, following standard procedure, orders a CT scan of the patient's lumbar spine.
Now, traditionally, the doctor would have to wait for a radiologist to analyze the scan and provide a report, which could take some time.
That's right. But with BiMediX2, the ER doctor can get immediate insights. They can feed that CT scan directly into BiMediX2 and start asking questions.
I can see how that could be incredibly helpful in a fast-paced environment like the ER. Walk me through how this interaction might go.
Sure. The doctor could start by asking BiMediX2 a simple question, like, can you describe this scan?
And what happens? Does BiMediX2 respond with a bunch of technical jargon that only a radiologist could understand?
Not at all. BiMediX2 is designed to communicate in clear, concise language that anyone can understand. It might respond with something like, this is a sagittal CT scan of the lumbar spine, which means it's showing a vertical slice of the body focusing on the lower back.
That's helpful. But as an ER doctor, I'm looking for more than just a description. I need to diagnose the problem.
Of course. That's where BiMediX2's analytical capabilities come in. The doctor could then ask, what's the abnormality here?
And BiMediX2 can actually identify the specific issue.
That's right. After analyzing the CT scan, BiMediX2 might pinpoint there's a fracture in the L4 vertebra.
Wow, that's incredibly specific. Can a doctor ask follow-up questions to get more context or information?
Absolutely. They could ask things like, what does that mean? Or what are the potential causes? And BiMediX2, drawing on its vast medical knowledge, can explain that a fracture is a break in the bone. It could explain that in this case, the fracture was likely caused by the trauma of the fall. And it might even provide information about the typical treatment options for that type of fracture.
It's like having a radiology expert right there in the ER, available to consult 24/7. I imagine that could significantly speed up diagnosis and treatment.
Exactly. It has the potential to be a game changer for emergency medicine, especially in situations where time is of the essence.
Okay, that's a very compelling example. But we know that BiMediX2 is also bilingual. Can we hear about a scenario where it's used in Arabic?
Of course. Let's imagine a prenatal clinic where the primary language spoken is Arabic. A pregnant woman comes in for a routine ultrasound.
So a very different setting and specialty than the ER.
Right. But the beauty of BiMediX2 is its versatility. The doctor can take the ultrasound images and feed them directly into BiMediX2, interacting with it entirely in Arabic.
So they could ask questions like, what kind of scan is this? Or what does it show? All in Arabic, and BiMediX2 would understand and respond accordingly.
Precisely. BiMediX2 is fluent in both languages, switching between them seamlessly depending on the user's preference.
That's remarkable. What kind of information might BiMediX2 provide about the ultrasound in this scenario?
It could start by identifying the type of scan, saying something like, this is a color Doppler ultrasound scan of the fetus, Then, based on its analysis, it might point out specific anatomical features, such as the fetal heartbeat or the position of the placenta.
And what if there's a potential problem? Can BiMediX2 detect abnormalities?
Yes, BiMediX2 is trained to recognize a wide range of potential issues. It might flag something like unusual fetal growth or a potential issue with the amniotic fluid prompting further investigation by the doctor.
That's incredible. Even in this setting, where access to specialized medical expertise might be limited, BiMediX2 can provide valuable insights and potentially help identify problems early on.
That's the transformative power of this technology. It's making expert medical analysis more accessible, regardless of language or location.
Okay, one last example. Give me a scenario that really highlights the breadth of BiMediX2's knowledge.
Let's step into a research lab that's studying infectious diseases, specifically mosquito-borne illnesses. They've captured highly detailed microscopic images of a mosquito's head, focusing on its sensory organs.
Now we're talking about a very specialized area of knowledge. Can BiMediX2 handle that level of complexity?
Absolutely. BiMediX2's training encompasses a vast range of medical images, including microscopic ones.
So what kind of analysis could it provide in this case?
The researchers could ask BiMediX2 to identify specific structures in the images, like the antenna, the compound eyes, or the mouth parts. BiMediX2 could then provide detailed descriptions of these structures, drawing on its vast knowledge of mosquito anatomy and physiology.
It's like having an entomologist on call.
Right. And it goes beyond just identification. The researchers could ask BiMediX2 to compare these images to images of other mosquito species, helping them identify key differences that might be relevant to disease transmission.
So it's not just a diagnostic tool, it's a powerful research tool as well.
Exactly. BiMediX2's potential applications extend far beyond the clinical setting. It's a testament to how AI is transforming not only healthcare, but also scientific research and discovery.
These examples have been truly eye-opening. It's clear that BiMediX2 is a groundbreaking technology with the potential to revolutionize healthcare, making it more accessible, efficient, and effective for everyone.
I completely agree. It's an exciting development that offers a glimpse into the future of medicine.
But as we've discussed, it's important to use this technology responsibly and ethically, always remembering that it's a tool designed to augment, not replace, human expertise.
Well said. The future of healthcare is being shaped right now, and it's up to all of us to be part of the conversation and ensure that AI is used for the benefit of humanity.
And on that note, we wrap up our deep dive into BiMediX2. Thank you for joining us.